Okay, video number 2. So we just talked about hazards. I gave you an example of hazards. So now I want to start working on the slideshow. This is a slideshow given to us from the Asiana group. This is all up-to-date information. I went through and made some changes to make it easier to understand. So if you have any questions, please send me a message and I will talk about whatever you have. Perform basic first aid procedures. This unit comprises of 3 elements. Assess the situation, apply basic first aid techniques, and communicate the details of the incident. So assess the situation. When we first help someone, we need to make sure it's safe to work in the area. So the person could be electrocuted, so we do not want to touch the person because we can get hurt ourselves. So make sure it's safe, make sure that the area is clean, make sure there's no bad people. There's lots of things we could talk about with this. Then we're going to talk about the actual first aid techniques. There's many things we could do depending on what happened. But it's simple, it's easy, and we'll try to have fun with this. Then we'll communicate the details of the incident. So we'll learn how to share the information with a doctor so that way they can help the victim after we're finished. Okay, so performance criteria of this element: identify the physical hazards to you or someone else. So again, watch out for certain hazards. We'll talk more about that. Protect yourself and the casualties from more harm. So we need to wear protective equipment to keep us safe. So if that person is sick, we do not get sick. It's very important, especially with the coronavirus stuff going on now, that we really protect ourselves. And then final, check vital signs for breathing and heartbeat. So we'll learn all those things. So first, identify physical hazards. First aid can be defined as any care given to an injured or sick person is called a casualty. So someone hurt is called a casualty. Before professional medical assistance, ambulance, paramedic, nurse, doctor arrive to the scene to take control of the situation. So our job is to make sure that we do our best to help the person that is hurt and keep that person alive before a doctor or someone can come help. So we are not doctors. I'm not teaching you to be a doctor. If you want to go to school to be a doctor, I would be so proud. But I'm just giving you enough information to help the situation for when a doctor does come. Okay, so identify physical hazards. So when providing first aid, always protect yourself and others from more injury. Protect the casualty from more injury. Call for help. So we're going to call a doctor. We get someone coming to help. And then wear protective gloves. So rubber gloves. I'll have an example next when we start doing the actual first aid. Slide number 7. Check the area to see what can hurt you. So workplace hazards. Some examples: wet floors, wires, heavy luggage. The hazards when helping casualties. So maybe if you're helping someone and you're trying to pick them up and they're really heavy and you need help. So that's even a hazard. Bodily fluids. If the person is sick, do not touch their fluids. And the risk of further injury of the casualty. So always think about the person you're trying to help. Try not to move them too much. But always try to protect them as well as yourself. All right, looks like I'd have to make a third video. So I'll stop here and we'll start a third video.